Let's take a quick look at COVID-19 antigen test pricing with data from TK software. A COVID-19 antigen test looks for pieces of surface proteins from the SARS-CoV-2 virus to determine if a patient has an active infection. It is faster and less expensive, but also less accurate than the molecular or PCR test. Depending on factors such as the region, insurance provider, ultimate payer, and type of laboratory where a COVID-19 antigen test is processed, the price varies. The actual cost is estimated to be between $5 and $50. The Federal Families First Coronavirus Response Act, or the FFCRA, ensures access to free tests for COVID-19 regardless of insurance status and prohibits copays and deductibles for the duration of the public health emergency. Despite the transition in 2021 from mass testing sites to mass vaccination sites, COVID-19 testing is still generally available through federally qualified health centers, public health clinics, and primary care offices. Using price data from TK software, a medical claims clearinghouse, we can compare the average charged and allowable amounts for a COVID-19 test across the United States. This price data reflects the prices for the antigen test only and is specific to procedure code 87426, SARS-CoV coronavirus AGIA. There is a wide disparity in these charges. The statewide average allowable amount ranges from $19.87 in Rhode Island to $96 in California. There is also considerable variation within states. The average state maximum is $750. At the nationwide level, the average allowable amount is $56.41. The median is $55. Yet the Medicare Administrative Contractor Price Guidelines for this procedure is $45.23 for 12 states, DC, Puerto Rico, and the Virgin Islands. In all other states, it is only $35.33. And outside the Medicare program, there is no federal regulation for the price of COVID-19 diagnostic tests. If you can find them, rapid COVID-19 antigen tests are about $15, perhaps even as low as $12, at pharmacies and supermarkets. Related charges, which the FFCRA does not require insurance to cover, can raise the cost of a COVID-19 test. These charges can include 7 other steps, namely, the initial COVID-19 screening that may be required before a test, a physician's consultation, whether in person or by telemedicine, a doctor's referral, a facility fee, a specimen collection, an interpretation of the test results, and other diagnostic tests or procedures ordered to confirm COVID-19 or rule out other possible conditions. Any test could potentially incur some of these charges, adding significantly to the total price. Additionally, federal law only requires reimbursement for medically appropriate testing, allowing insurance providers to determine what tests are medically appropriate. They may refuse to cover testing after a trip or frequent testing required by an employer. Federal rules also don't apply to certain private plans, like short-term health insurance policies, and they don't stipulate the reimbursement policy for tests that have a listed cash price. While these federal rules attempt to reduce COVID-19 testing costs for patients, they may ultimately raise the cost of insurance as the cost and volume of testing grows.